Are you recording yet?
I am, but I'm going to do I'm going to start it now. Okay, so welcome. I am Lea Roselyn with the United Way of Douglas County, and I am joined by Becky from the Ballard Center and Rich from Success by Six Coalition. And I would just ask you both to take a minute to introduce yourself and to give a brief overview of your organizations. Becky, would you like to go first?
I'm Becky Price, and I'm the director of the Ballard Center. The Ballard Center is primarily known as an early childhood education center, but what makes us very unique is that we do wraparound services or safety net services for our families as well. And these services are hard to explain because every service depends on what the family needs. We have a pantry that has food, diapers, formula, hygiene products, clothing for all ages. And we do a mobile food distribution twice a month. So the services that we offer can vary from offering food to somebody that just needs a little bit of support to going to court with a victim of abuse.
Thank you, Becky.
I'm Rich Minder. I'm a collaborative projects coordinator for Success by Six Coalition of Douglas County. Success by Six is a little bit different than a lot of the agencies in town in the sense that we're a coalition, and we started around 1998. And through the 1990s, the early childhood community had been coming together more and more, and eventually they came together as a coalition intentionally. But from the very beginning and until now, the coalition has always worked to strengthen early childhood partners in the community rather than create a new or expanded set of services that we do. So, for example, we will strengthen the agencies that we partner with, such as, parent educators or early childhood mental health specialists or early childhood educators, rather than creating an agency that does a lot of direct service. So we push out about $1 million, a little over $1 million a year, pretty consistently. And then over the years, we've had various grants for topic areas, early and emergent literacy. Sometimes there'd be a grant that would strengthen our early childhood mental health system. Sometimes there would be grants that would work on supporting and improving early care and education. So that's kind of a little bit different, a little bit about Success by Six Coalition. We really help the coalition coalesce, help them come together and select, design, implement, and evaluate early childhood projects and programs and policies. And hopefully, we can create a policy and program environment in the community that works really well for pregnant families and families with young children.
Thank you. And thank you both for the work that you do. So we are going to have a conversation today focusing on the issue of child abuse, which I know that both of you confront on a daily basis, and it's a really hard issue for anybody to talk about. And so before we begin, I just really want to express my gratitude for the work that you do every day, for the personal toll that takes on you, and for really stepping up for our kiddos. Your work makes such a big difference, and I appreciate you so much. So, to introduce this topic, want to focus on what we suspect or know is happening in kiddos' homes right now. So for some context, since the COVID pandemic and people have been practicing social distancing, there have been fewer reports of child abuse made. However, experts indicate that child abuse is actually increasing rather than decreasing at this time. So a couple questions for both of you. One, how do we know that child abuse is increasing if reports are decreasing? And what would account to the lower reports and increase in abuse?
I think that the main thing is that, it's over 50% decrease in reports, and that's because the people that typically report are teachers, and there are no eyes on the kids out there, so that nobody is seeing what's going on. It's going on behind closed doors at home, and we might suspect it or think that it might be happening, but there's nobody to see the kids and to make the reports. We know that it's increasing because, I mean, there's decades of studies that when there's high stress is when there's going to be more abuse. And I've never lived through a time where there's more stress than this. In addition, there's very much a correlation between poverty and stress and child abuse. And I think that we all know that everybody is incredibly stressed, and people that have never feared of not having food for their kids or being able to make the rent are now facing that.
Right. I agree with what you said, Becky. I think one of the things that's, Lea raises is that it's difficult in this environment to be able to get the kind of data and information that is helpful. But just on the face of it, if you think about a 50% decline in reports, anytime there's that kind of a data change, then you sort of have to ask the question, is there something wrong with our data here? Just in terms of the reports, there's this decline, so that you have to call into question whether or not that data is valid. And then in terms of actual unreported cases, whether there's more or less now, it's really difficult to say, because where is the reliable data? I think what Becky said is, I sort of agree that just in general, we know from research that when families under a great deal of stress, we aren't at our best. So it would kind of make sense that there would be an increase. And we have different sources of data and information that are indicating that, but it's just really, I get stories of a case here and a case there with our partners, but I don't know the larger data pictures, so that's difficult.
I do know that there's been an uptick in the number of children going into hospitals or emergency rooms with serious trauma. But also, I think that it's not just that there's, I don't have any specific statistics on that, but there's also the challenge of nobody wants to go to a hospital right now. So many of our families, any doctor's visits or so many of the services out there are done via video or via virtually. And many of our families don't even have the ability to do that. So that makes it harder. And I know that it'll be interesting to see what the statistics are once we see the number of cases. If a family does take a child to the hospital, it's got to be extreme.
Right. And I think that's one of the biggest issues right now, is that there really may be nobody outside of the family seeing what's going on in the home at this time. The kiddos aren't going to school. A lot of the, if they had a home visitor or somebody coming to check in the home, or social service provider, a lot of that's happening online. The schools, the Boys and Girls Club is doing online programming now, so they can have face-to-face contact with the kids, but it's not in private. And so really we have lost all of our opportunities to have any kind of isolated time where we could get disclosures of child abuse or investigate more, hear what's going on with the kiddo's life. I have a couple of follow-up questions about sort of the regular process of reporting child abuse and what happens with that kid, and maybe a more ideal system for our community. But I want to go back first to Becky. You had mentioned that there is a correlation between child abuse and poverty. And while we know that child abuse and neglect can happen no matter what your income level, there is some connection between the stress of living in poverty and abuse. What do you think that connection is, both of you, from your experience and the work that you've done? And how can we be supporting families that are living at or near poverty to have more healthy home environments?
I think that so much of it is just that the child abuse happens not so much if there's poverty, it happens on all income levels, but it's when there's a normal high level of stress that's going on. And living in poverty is incredibly stressful. So I think that that's just a lot of it. And right now, parents are home. So many have lost their jobs, and they now are trying to homeschool and try and take care of these kids and figure out how to feed them. And they're not as privileged as I am, and they can't go to the store and buy plenty of everything and make sure that they have everything covered. And so I think that it just is adding that's what's adding the stress level, which can often lead to child abuse.
Yeah, I agree with that. I was thinking about this question over the last several weeks, and even before the situation settled in here with this coronavirus, we've tried to look at abuse and neglect through some kind of a useful framework, and trying to consistently look at it not just in terms of risk, but in terms of protective factors. What is it that all families need to do well? Those 5 protective factors are, some of the things and how they're related to poverty are pretty clear. One of the protective factors that they know that prevents child abuse or raises the likelihood that we're preventing childhood abuse and neglect is access to concrete supports in times of need. And poverty is certainly one of those conditions where concrete supports become more and more scarce. So again, trying to think about, what is our current situation? And as Becky was saying, when you're having more and more desperate financial situations, then, you're going to be missing that protective factor. Mm-hmm. Another one that comes to my mind immediately when I think about the current situation and how it's related to poverty is that another protective factor is this sort of access to supportive social relationships. Mm-hmm. And, if the baby is crying consistently for 4 hours and you have, a stable, safe friend who can kind of take over for a little bit, or if you have, your children are really acting out and everybody's bored and, familiarity breeds contempt. And then you have a neighbor who can watch the kids a little bit, or, these supportive social relationships are really useful in preventing child abuse and neglect. Well, in a world of social isolation where we're now prohibited from doing that, well, then we're actually telling people not to access that protective factor. Another one is parental resilience is another protective factor. Like how well can parents bounce back from a crisis? Right. And that's a really difficult concept to understand. But if you're in poverty and you have consistently been conditioned to believe that when something bad happens, bad things just keep happening, then your ability to be resilient and to bounce back from another flat tire or whatever it is compromised. And so, people try to always say that poverty is sort of a backdrop. It's not really a cause of child abuse and neglect, but really because poverty and those sometimes the lack of access to protective factors is so correlating that really it doesn't make much sense to say that poverty isn't a cause. I mean, it's just as well a cause of a lot of really bad things in our society. So, to me, that those protective factors are a useful lens for thinking about it, because we know from research that those protective factors are good for all families, and we can see how poverty compromises access sometimes to those protective factors.
Right. And right now, the pandemic is doing that to everybody. Right. It's feeling so disconnected, and our connections are through a Zoom. If you have a Zoom set up, and phone calls, and I think one of the things that we worry about too at Ballard, since we are trauma-informed curriculum and services, and our staff are all trained to kind of identify the risk factors and to identify the signs, is just the domestic violence. And the effects of domestic violence on kids is just really scary and appalling. And for parents to understand that when kids witness domestic violence, it's harder on them than being abused themselves, and the long-term effects of that, because they're just all, when you're on top of each other, when you're not used to it. And it's one of the hardest things we ever do is try and explain to a parent that even if your child's not being abused or hit, that the effects that it has on them to witness that is lifelong and
Yeah.
really not good.
Again, going back to that connection between poverty and abuse and neglect and protective factors, I try to look for silver linings sometimes to see if there's something that we're not seeing that's actually a positive thing. And, when I was looking into there was a group of us that were looking into these 5 protective factors, and, the one about social connections,
Right.
we see often in impoverished environments where many people are living in poverty and are desperate, that the ability to trust the system and the people around you tends to decline. So like if you're in an environment of high trust and you're interacting with people, then you're releasing oxytocin. There's a positive sense of being with other people, and that builds trust, and that sort of spirals upward. But when you're in an environment where it's hard to trust people, then the opposite happens. It sort of spirals downward, where there's less and less. And to put this in a kind of a hopeful, I'm not saying that I have data to support this, but sort of a hopeful thought is that this crisis sort of puts everybody on an equal footing, and we all have to be in this together. And some of our institutions, especially at the local level and at the state level, I think have really stepped up to send out signals to our communities and to our families and to people that, hey, we've got this. Here's what you need to do, and we're all in this together. And you're starting to hear people coming together about, okay, we're all in this together. And to some extent, I think that lays a groundwork for more trust. And so, that might be a good thing. Maybe we're taking some people out of an environment where it used to be, well, those people over there can trust one another, but not where I live. To maybe now we're looking at the world as kind of, we're all in this together, and that might at least set the stage for more trust.
I agree with you, Rich. I think that it might, and it hit me when you said earlier about the resiliency. We are privileged people are not nearly as resilient as people who have dealt with these issues and battles their whole life. They might be doing a hell of a lot better than us, just because when you're used to kind of having smooth sailing, and I think that's one of the things that's bringing us together is that, whoa, I get what it's like. It doesn't matter how much money you have. If you want toilet paper right now, it's going to be a challenge. Or if you just not having the access to your friends and your support system, it's happening to everybody, regardless of what your lifestyle is.
Absolutely. And I'm really hoping that it gives the community at large a greater sense of empathy for people that are living in poverty, and having the opportunity to see firsthand how one major event can disrupt everything in your life.
Right.
And that we kind of count on, like you said, Becky, the smooth sailing, systems working, and those of us who are privileged enough not to live in poverty, we do expect the systems to be functioning and to be able to get our basic needs met in the way that our friends and neighbors and community members living in poverty every day know that the system has not been working, that more is needed to support the social safety net. And now all of us on a mass scale are really seeing the impact of a weak safety net and the importance of having trusting relationships, of coming together as a community to support each other.
I have been so amazed with the number of people that reach out to Ballard, and it's like, I want to volunteer. What can I do? What can I do? Our biggest problem is having staff to oversee it and rally everybody, because people are really stepping up and they're willing to share what they have. And I love the Lawrence community, but it's been exceptionally more. I mean, it's just been exceptional. I have so many random acts of kindness constantly. And I hope that that's something that we can continue, because this is going to be harder on especially nonprofits, on everybody. It's not just this emergency that we're dealing with right now and stuck in our homes. It's going to be the aftermath of it that terrifies me.
Going back to the comment, Becky, that you made about resiliency, one of the things that I've been cautious about mistaking is when people who are really up against the wall and have been for a long time and are lower income and
Right.
living in poverty, we don't want to mistake downscaling expectations for resiliency. I think sometimes what happens with people, they think, oh, well, it must just build character to not have to have your utilities on for a week, or we really didn't need that health insurance, or so I think we have to be careful with people who live in poverty. Whenever it looks like they're being resilient, let's be careful that they're not downscaling their expectations.
Right. But I think so much of it is thinking outside of the box. That's one of the things that we've had to start doing, is like, especially leading Ballard, is like, okay, so we don't have these resources, we don't have this, let's think outside of the box. And I think that's one thing that people that live in poverty are pretty good about, is whether you call it resiliency or what.
Resourcefulness,
Resourcefulness is, and some of us are just used to, well, these are the rules, this is what we do, this is how we do it. And it's, so when we at Ballard, all of a sudden we could get plenty of donations to put food boxes together for our families, but it was endangering my staff. It was time consuming. We were working 16 hours a day. It's like, I can't do that anymore. So how are we going to make sure our families have food? And when we're on daily Zooms with my staff who are dealing incredibly with the secondary vicarious trauma, that it's like, okay, well, we can't stop. It's like they're willing to endanger their health to keep making sure that our families have food. So it's like, how can we do this? What do we do? There's got to be a way. And that's why we're going to do an adopt a family with all of these incredible people in our community who are like, how can I help? How can I help? I'll bring you donations. I'm like, no, don't bring them to me. We're going to match you to one family, and you connect with that family and get them the food. If you need to do it online or however you need to do it, let's do it that way. But it's hard sometimes. I think it's easier for people that have had so much to overcome to learn to think outside of the box. And I think it's harder for some of us who are just used to, this is the way we've done it, this is what we've done always, this is the way we're going to do it. But you just have to stop and go, how the hell are we going to feed our families? We'll see. We just started it. Hopefully in a couple weeks we'll say, hey, all of our families are fed. I don't know.
Well, I'm so appreciative of your innovation and just your willingness to do whatever it takes to make sure that the kiddos are, minimally have food in their bellies.
Right.
So I have a couple more other questions. I want to talk about the CAC for a minute, Becky. So maybe we can talk about that first and then end with sort of a how to help. So going back to child abuse, can one of you walk us through when, for instance, if I am a early childhood education teacher and I suspect that one of my students is being abused, what would the process be like? Who would I call? And then what theoretically would happen after the call is made?
Rich, I'll let you take this. I don't want to get in trouble.
You've heard the term the mandated reporters. So we have the people who are social workers and teachers and so forth are mandated reporters. So there's a hotline that you would call. Now this is the formula. I mean, I think you make this call, and actually I've never made a call. So but I think that at that call center they ask a number of questions and then they make a decision about whether or not this is something that they want to follow up with or not, and then. If they're going to follow it up, then they would send it over to the local DCF office, whoever is in charge of that, and they would initiate an investigation. That might just be something that's very brief and checking in with the family, or it might be something more intense. And then I think if those investigators feel that this is a case that they can either assign it to some family support services, so they can see, do you have family preservation services at an intense level or a not so intense level, or then they can send it to a different provider for the family first kind of intervention with a home visitor, for example, or something. And then I think as things go, if it is just something where the investigation just makes it clear that this is just something where this child is in danger, like right now, then, they could just immediately remove that child from home. I think there are good reasons why the state is really loath to do that. Breaking up families is sometimes necessary, but if there's a way to intervene with that family and get them what they need so that they can pull it off themselves, it's like everybody prefers this, I think. Making that judgment call is not something that is probably easy, or that any of us would really just jump at the chance to do. Going back to the teacher who observes a child who they suspect of abuse and neglect. When I was on the school board, we had a discussion about this with elementary age kids. And, one of the things I think with teachers is that was expressed is that, we have this relationship with this family. We have this relationship with these, with these kids in this family. And if I'm making a call here, then one of the impacts on me is that now I have this other thing in my relationship with this family. It was sort of acknowledged that this is a challenge in the schools for public educators to deal with this. I would say that in early care and education, not only do you have that relationship thing, but you also have a monetary relationship with families where, they're paying your bills with tuition. And so I think that I'm just introducing this as some of the complications I think that are out there when we talk about, abuse and neglect. This is not just a relationship with a parent and a child and a third party objective observer. We are all enmeshed in relationships that have economic consequences and relational consequences they're real, and we need to acknowledge them. And I don't know that I have any answers to those, but I think that they're really important that we acknowledge these things.
I appreciate that you said that, Rich, and I even more so than the economic consequences for Ballard, for sure, is the consequences of if you suspect something, that the parent's going to know where the report came from. And so that if you really feel that, because Ballard is very much trauma informed, we check our kids every day. We just do. And Leah's gone now, so hey, Lea.
Hi, I'm back. Sorry, I froze up again.
I know. I like it when you freeze up. I hope when I freeze up, it'll be a good angle.
I know, it's always a little disturbing. Like, what face was I making? Okay. Well, sorry I missed your last point, but well, I'll pretend that I heard it.
All my points.
So, Becky, you and the Ballard Center have been working on developing a CAC for Douglas County, which we're unique in the fact that we don't have a CAC. Right. So I'm hoping that you can explain what a CAC is, why it's important for our community and kiddos, and what our community can do to support your efforts.
So a child advocacy center, or a CAC, is a place where children who've been abused go. It's a child-friendly center, and it's a safe place where all of the people that work with kids that have been abused partner. And the core of a CAC is all about collaboration. So whether it's a teacher, whether it's the police department, the Child Protective Service or DCF, mental health, it's a place where a parent can feel safe, take their child and know that it's kind of one-stop shopping. It's, okay, here's what's happening and what resources do the parents need? If it gets to the point where there needs to be an investigation, then, the law enforcement's involved. If the parents need therapy, if the child needs a good therapist, if they just need support systems in place financially, it's the safety net spot for parents to feel safe to go. And at the core of it, again, is just about the multidisciplinary team. And that's made up of mental health, medical, law enforcement, prosecutor, and then the advocacy groups, so that the people that are going to support them. So it's, like you said, Leah, it's unusual that, I mean, Lawrence does not have one. Douglas County does not have one. We are the only place the largest city in the state that doesn't. And so we've been working towards forming one, and before the pandemic, we were really close. We were getting there. But it's all about, if you discover that your child's been abused, that there's a safe place to go that's not just going to get you the medical forensic exam or the police involved. You're going to have advocates and people that surround you and help you walk through that and navigate the system, because the system is complicated, and you need somebody that's going to have your hand and have your back and help you come to terms with the fact that this has happened to your child.
It would be such a great resource for our community. I think, when I think about trauma, being abused physically, sexually, emotionally as a child causes horrific trauma. But we know that one thing that can help negate that or help a child overcome that trauma is by offering really comprehensive community supports. Right. And making sure that they are getting their whole physical, emotional needs met. And when I think about a kiddo, being taken from the police department to the hospital to places where they're unfamiliar, maybe in another city, all of that is adding to the trauma of the primary trauma they experienced of abuse. And so really
over and over, yeah.
Right. So really, by having a CAC, it's about negating the impact of trauma for that child and family. Is there anything that people can do at this point if they're interested in supporting our community having a CAC?
At this point, I think just, like so much, it all comes down to the financial support, operational funds to keep it going. And so at this point, everything's with the pandemic, we're kind of on hold. We have the support of our community. So please reach out and thank our DA, our police department, DCF, Burt Nash. Reach out and thank people for agreeing to commit to this, and that this is really important. We're always better when we're together. We just always are. And the more we collaborate and work together to minimize the trauma, the better our world's going to be.
Thank you.
You're welcome.
So before we end, I want to ask each of you to share maybe one thing. I know, Becky. One thing that you would ask the community to do right now to support a child. If somebody is watching and they can, do one thing from home, or if it's safe for them to go out of their home, what would your call to action be?
I really think that the main thing is, even though we're all isolated and we're in our own homes, it's the bystander intervention is incredible. So many people they don't know what to do. They don't know how to do. You might see something that feels so wrong to you. But you don't want to get involved. You don't want to be a part of it. You don't want to piss off your neighbor. But some of it is, if you see kids outside and your gut knows when something is just not right. So really at this point, it's about just checking in and making a call. If you feel it's much better to make a call and there's nothing, is way better than to not do anything. If you suspect that your neighbor or somebody that is in danger, And if you're, there's signs that you could look for if you're a family member and you are seeing them. One of the things that Ballard's doing, other than the daily contacts, we're getting eyes on once a week, and sometimes that's hard. But there's an app called Marco Polo. There's probably lots of apps out there, but you can make a video, you can read a story to a friend or anybody. And if they have this app on their phone and it's free, then the kids can watch it whenever they want. Part of the problem with the Zooms or the Facebook is that the parent has to be involved, and it's at a specific time. But one of the things our teachers is doing is like giving the kids a lesson or reading them a story or just talking to them. The kids can watch it over and over and over, and they can watch it when they want. The parent just hands them the phone and they play it. And then the kids can also say, "Thank you, Mitra, for the story," and at least then it's seeing a face. So if you have a friend or a child or a neighbor or a family member that you might be worried about, just think outside the box and figure out how to get eyes on and how to connect with them, even if it's virtually.
Thank you. Rich.
One thing that so you're asking if there's one thing that I would say that people can do. Yeah, I guess I wish that I had an answer. Part of it is that I've got people that I talk to who are human service professionals and educators and so forth. And one thing I might say to them is different than I might say to a family. It might be different than I would say to. And so there's so many different people that I would say different things to that I can't come up with one thing. I guess if I was to think about one thing that I would say that I would hope we could figure out how to resonate with everybody is to always look to see what are the strengths that individuals, people, parents, children have, and help recognize your own and other people's strengths and see what you can do to strengthen them with access to what they need. And wherever you're coming from, and that's not one thing, that's many things, that's many strengths, and it's many different protective factors, but it's maybe a way to look at things. So looking at strengths and building them up and building people up as best we can.
What a beautiful way to end. Thank you.
Thanks, Leah. It's good to see your face always.
It's good to see both of you. And thank you so much both for your time. I appreciate you both.
Thanks, Leah.
I appreciate you so much, Leah. Love you.
Love you. Bye, friends.
Bye.